Hi everybody. So we are going to start our new video series on the head and neck anatomy, and I will be starting from a cavity which is very important, and it holds a very important organ, that is orbit, the orbital cavity. We will start from the orbital cavity and then we'll move on. In today's video I'm going to cover the definition of orbit, its margins and walls, along with the openings of the orbit and the structures passing through these openings, the connections of the orbital cavity with the other facial regions, and eventually the clinical correlates. So this is all we are going to cover in this video today, and the next future videos will be covering the other parts like the extraocular muscles, the eyeball, which is ophthalmos or ocule itself. We'll do step by step. So today we are going to cover the bony orbital cavity. Okay, to start on, we have to understand that the orbital cavity, it's roughly a triangular space, or a triangular like this, like a cone shaped cavity with its apex projecting towards the cranial cavity. And if I go much precise, the apex of the orbit, which is pointing backward towards the cranial cavity, which part of the cranial cavity? The middle cranial fossa. Okay, so the orbit, you can see the opening of the orbit from the front of face with all its margins, and it has sloping walls, and the apex of this cavity is projecting medialward slightly, like if I put this cone like this, slightly medialward and backward, okay, towards the middle cranial fossa. So in other words, we can say that the orbital cavity is in communication with the middle cranial fossa. That is clear. So the orbit has its margins. So first we will look at the margins. Before that, I have to mention that the orbit has been, the bony orbit has been formed by almost 7 bones of the face and cranium. So you must have noticed that I have given some color codes to different bones to make you understand in a better way. The green colored bone is the frontal bone. This pinkish colored bone is the maxilla. It's a very prominent bone of the facial skeleton. Then this white colored bone is the zygomatic bone, which is the prominence of our cheeks. This blue colored bone is the lacrimal bone. The red one is the part of ethmoid bone. And at the back, you can see over here there is a mustard colored bone, which is known as the sphenoid bone. It's a very complicated bone, and it is present almost everywhere in the skull. Okay, so we'll take one by one. So first we'll focus on the margins of the orbit. So the margins are 4, as you can see. The superior margin of the orbit, you can easily appreciate, has been completely formed by the frontal bone. The superior margin also towards the nasal end or the medial end has a notch, which I don't think so you are able to appreciate, but there is a notch which converts into a foramen in a live state. But as a person is dead, the bone is dried up and all the organic material of the body is been degenerated, so there is no ligament, so it remains as a notch. This is known as the supraorbital notch, and it is there for the passage of nerves and vessels with the same name, the supraorbital vessels and the supraorbital nerve. Okay, then the superior margin has been formed by the frontal bone. The lateral margin, you can see it's pretty sharp and all of us can feel the lateral and the superior margin very discreetly. The lateral margin is being formed by a process which is descending down, projecting down from the frontal bone, that is the zygomatic process of frontal bone, and the frontal process of zygomatic bone, this white colored bone. So the lateral margin is very prominent. Majority of the lateral margin has been formed by the zygomatic bone and a bit of frontal bone. Then comes the inferior margin. Inferior margin is not as sharp as the superior and the lateral on palpation, but we still can palpate it. Okay, so the inferior margin, you can see it's a 50-50 ratio. 50%, the lateral 50% of the inferior margin has been formed by the zygomatic bone, and the medial 50% of the inferior margin has been formed by the maxillary bone. Okay, so there is a 50-50 ratio when it comes to the inferior margin of the orbit. Okay, so medial 50% maxilla, lateral 50% zygomatic bone. Then comes the last margin, which is the medial margin, and as compared to the lateral margin of the orbit, the medial margin is not prominent at all, and we can feel even on our face it's like blunt and sloping type, not very discrete angular, sloping, because it is sloping towards the nose, over the nose. Okay, so the medial margin is blunt, but it has been formed by the nasal process of the maxilla, okay, and a bit of the frontal bone. That makes the blunt medial margin of the orbit. So we are done with the four margins: superior, lateral, inferior, and medial margins. Now we'll go further inward towards the orbital cavity and we will explore the walls. Okay, and I have mentioned in the beginning that the orbit is not like a straight conical cavity. It's like sloping at an angle, medialward. Okay, so we can say first we will start from the lateral wall, and you can see that the lateral wall, anterior part of the lateral wall has been formed by the orbital plate of zygomatic bone, which is this white bone, and the posterior half of the lateral wall is being formed by the greater wing of sphenoid bone. Okay, remember I mentioned that the sphenoid bone is a very peculiar shaped bone and it is present everywhere. It's like it's participating in the foundation of many structures, many cavities of the face and the cranial architecture. Okay, so the lateral wall of the orbit is being formed by the zygomatic bone anteriorly and the greater wing of the sphenoid posteriorly. Then comes the medial wall. You can see there are many structures involved in the medial wall. So the medial wall, anterior bit of medial wall is being formed by this blue colored bone, which is a very small bone, and it's known as the lacrimal bone. Okay, so the very anterior limit of our medial wall of orbit is being formed by the lacrimal bone. Just behind the lacrimal bone is this red colored bone, and that is a part of the ethmoid bone. And the ethmoid bone is also, just like the sphenoid bone, is a very peculiar shaped bone. It's irregular and it's a spongy type of bone. It has many air cells, just like a sphenoid bone. So which part of ethmoid bone is participating in the formation of medial wall? It's the lamina papyracea, or paper thin part of the ethmoid bone. That is that holds the ethmoidal labyrinth inside it. And I'll talk about the ethmoid bone in detail. You just have to remember that the ethmoidal labyrinth is making the medial wall of the orbit. That part is also known as lamina papyracea. And this labyrinth is also making the lateral wall of the nose. It makes sense. Okay. Now come to the superior wall, which is also known as the roof of the orbit. And you can see, if I'm tilting the skull, you can see the almost entirely, like 90%, 90 to 95% of the roof of orbit is being formed by this green colored bone, that is our frontal bone. Okay, so the roof of the orbit has been formed by the orbital plate of frontal bone. And orbital plate of frontal bone is like it's a thick, like it's a rather thin part of the frontal bone, and it is, if I'm holding it like this with the help of my finger in the orbital cavity and my thumb in the anterior cranial fossa, you can see I'm holding at the orbital plate of frontal bone. So the orbital surface of orbital plate of frontal bone is smooth, it's caved and it's smooth, while the superior surface, or the part or the surface which is present in the anterior cranial fossa within the cranial cavity, you can see it is all corrugated. It gets the impressions of the frontal lobe of brain. Okay, so come back to our topic. The roof of the orbit has been 95% formed by the the orbital plate of frontal bone. And at the very back, I don't think so you'll be able to appreciate, but at the very end, the remaining 5 to 10 to 5% of the roof has been formed by the lesser wing of sphenoid, which is up here. The lesser wing of sphenoid you can see here. Okay. Then comes the floor of the orbit. The floor or the inferior wall of the orbit, as you can see, it's not straight, it's not horizontal completely, it's like sloping because of its medial wall. Yeah, so the sloping floor of the orbit has been, majority of the floor has been formed by the orbital plate of maxillary bone or maxilla. The orbital plate of maxilla is making the floor of the orbit, and just like the roof, a little bit at the very back, the posterior medial part of the floor, which I think you are not able to appreciate, but it's at the very back, there is a bone which is participating in the formation of hard palate, that is the palatine bone. So the orbital process of palatine bone is also participating in the floor of orbit. Okay, so all we have to remember, there are roughly 7 bones which are configurating, they are forming the bony orbit, and among these 7, few of them are very prominent, like frontal bone, the maxilla, the zygomatic bone, the ethmoid bone, the lacrimal bone, and you can say the greater wing of sphenoid, which is visible on the lateral side. Okay. Functionally speaking, when I'm describing the walls, so we have to think that it's a bony cavity and it can get damaged. There are the possibilities of fracture of the orbit. So which walls are more fragile? Which walls are more sensitive to get fractured? Mostly it's the medial wall because of this ethmoidal labyrinth or lamina papyracea that gets fractured very easily, and you can understand that it will, the fractured orbit will lead to the herniation of the contents of orbit into the ethmoidal air sinuses. Okay, because just behind this red colored piece of bone, the plate of bone, is the ethmoidal labyrinth, which is the air cells of the ethmoid bone. Okay, we have ethmoidal air sinuses. The next wall that is fragile to get fractured, it's more prone to get fractured, is the in case of a front blow to the orbit, is the inferior wall. And you can understand that this bone, the maxilla, it is hollow from inside. The body of maxilla is hollow from inside, just like many other facial bones, because it contains the largest of all the air sinuses, paranasal sinuses, and that is the maxillary air sinus. So again, there is a chance of herniation of the orbital contents into the maxillary air sinus, which is located here. And if the floor of the orbit gets fractured, the contents can herniate into the maxillary air sinus. If the medial wall gets fractured, the contents of the orbital cavity may enter to the ethmoidal air sinuses. Okay, this is all about the walls and the margins and the clinical correlate of the bony orbit. Now let's talk about the contents of the orbit. So in the orbital cavity, we have many structures, not just the eyeballs. So we have the extraocular muscles. There are 6 of them, and then there is another muscle which is going to control the movement of the eyelid. I will talk about the muscles in detail in our next video. So the extraocular muscles, which are responsible for the movement of the eyeball. Then we have the eyeball itself, which is known as the ocule or ophthalmos, and we know that the eyeball itself is a very like, as compared to the size of the orbital cavity, the size of the eyeball, which is spherical in shape, is much smaller. So I'm going to talk about it. How does it fit into the orbital cavity? Why it's not dropping off all the time whenever we are blinking or we are moving our eyeballs here and there. There is something special present in the orbital cavities. So extraocular muscles, the ocule along with its tunics or coats. Then we have the nerves, which are serving the eyeball as well as the mucosal lining of the orbit. So we have a nerve which is extremely important nerve for our life, that is the optic nerve, the second cranial nerve or nerve of vision. And then other than that, there are few nerves which are going to innervate the muscles of eyeball, the extraocular muscles, the intraocular muscles, and then there are nerves which are going to provide sensory innervation to the mucosal lining of the orbit as well as the outer surface or outer covering of the eyeball. So we have the extraocular muscles, the ophthalmos, the nerves, and then vessels. The vessels, there are basically 3 vessels which are entering and leaving the orbit. The ophthalmic artery is entering the orbital cavity to irrigate the structures present in the orbital cavity, and the superior and inferior ophthalmic veins will be leaving the orbital cavity. Okay, other than these structures, we have something which is playing a pivotal role, and that is known as the extraocular fat. The extraocular fat is occupying the remaining part of the orbit, which is left after the eyeball and the extraocular muscles and the nerves and the vessels have filled up the orbit. There is still a lot of space left behind. That has been filled up by the extraocular fat, and that is why it's playing the role of a packaging material, right? It's securing the eyeball in its anatomical position throughout our lives. And as we age, the extraocular fat it reduces in amount. So you might have noticed that the elderly people, if you look at their old photographs when they were young and you compare them with their current state, like a 90+% or an 80+%, you will find that their eyes are sunken because they have lost that extraocular fat. Okay, which was giving a supple appearance, a beautiful appearance to their eyeballs, to their eyes, which were closer to the surface and they were smooth. So that suppleness is gone as they lose the extraocular fat with the progress of age. Okay, so these are few points which you have to keep in mind. We are done with the contents. Now we'll talk about that doesn't mean we are done with the contents. We'll do the details of the contents in the later videos. But now what we are going to talk about are the openings or the communications which are present within the orbital cavity, the bony orbit. So as you can see on this side, there are two fissures making a V, right? The narrow end or the tip of the V is facing medialward. So this fissure is known as the inferior orbital fissure. And a fissure, so this inferior orbital fissure, technically speaking, is running in the gap within in the floor of the orbit. Okay, so the inferior orbital fissure, and then we have another slit present in the roof of the orbit, so we call it the superior orbital fissure. Okay, so inferior orbital fissure, superior orbital fissure, and you can see where the two fissures meet, there is another hole which is the hole for the optic canal. Okay, now let's talk about the connections. Via the inferior orbital fissure, the orbital cavity is communicating with the space which is present behind the ramus of mandible and behind the zygomatic arch, below and behind the zygomatic arch. That space is known as the infratemporal fossa, okay, which is present here. So via the inferior orbital fissure, the orbital cavity is communicating with the infratemporal fossa, and also it is communicating with another space, another fossa, which is much smaller, and it's pretty much invisible when we look from front or from side, but it is visible if we look harder. Here you can see, here, this fossa is known as the pterygopalatine or sphenopalatine fossa. So now I will show you something that will make you understand it in a much better way. The pterygopalatine fossa, or the sphenopalatine fossa, we all know contains the second division of trigeminal nerve, that is V2, or the maxillary nerve. Okay, now you know that the maxillary nerve passes through, it originates in the middle cranial fossa and it passes through the foramen rotundum. Now let me show you the middle cranial fossa, and here is our foramen rotundum. I hope that you can see. My probe is passing through the foramen rotundum. So you consider the probe as the V2, or maxillary division of trigeminal nerve. And now have a look. I'm moving the probe and you are able to see. Oh, okay, have a look. This is the maxillary division of trigeminal nerve. So via the inferior orbital fissure, the orbital cavity is communicating with this pterygopalatine fossa, where the maxillary division is residing, and also with the infratemporal fossa, where the mandibular division will be residing. Okay, we'll talk about it. So we can say that through the inferior orbital fissure, the orbital cavity is communicating with two spaces, the infratemporal fossa and the pterygopalatine fossa, or the sphenopalatine fossa. Now, with this fissure, the superior orbital fissure, which is running in the roof of the orbit is communicating with the middle cranial fossa. Okay, because we just have spoken of that there are nerves which are entering the orbit to serve the eyeball, to serve the mucosa of the orbit, which the nerves are originating in the middle cranial fossa. Okay, so we can say that the orbit is communicating through the superior orbital fissure with the middle cranial fossa. There is another connection, another door that opens up into the middle cranial fossa. That's a round door, and we just have spoken of. That is our, if I enter my probe through the optic canal into the optic canal, here I am entering. Okay, again it's the beginning of the middle cranial fossa. So this is the anterior cranial fossa. The lesser wings of sphenoid are marking the posterior limits of the anterior cranial fossa, and from here the middle cranial fossa is started. So this is the beginning of the middle cranial fossa, and my probe is in the optic canal. Okay, so we can say that there are three major doors which are present in the orbital cavity, and these doors connecting the orbital cavity to different spaces of the cranium as well as face. Okay? There, other than these three doors, there are two very minute openings which are not visible on this skull, because it's not an original specimen. It is a model. It's like it's made out of some clay. So it's not, it cannot be, these two openings cannot be appreciated on this model. But they are present in the real skull, and they are present in the medial wall and just over these, over this lamina papyracea, or the ethmoidal labyrinth, the anterior ethmoidal and the posterior ethmoidal foramina, okay, for the passage of the nerves and vessels. Got it? Other than that, there is something which I just described in the beginning, the supraorbital notch, because in the roof of the orbit is running the supraorbital nerve, which is a branch of the first division of trigeminal nerve. So the supraorbital nerve, along with its artery and vein, is passing through this notch, the supraorbital notch. Supraorbital nerve and supraorbital vessels, which are going to supply the skin of the forehead and the scalp. Okay, here you can see, up here is a it's an infraorbital foramen, and it stays as a foramen. This was a foramen when a person was alive, because it got transformed into a foramen with the help of a ligament. But when a person is dead, the bone is dry, the ligaments are lost, so it becomes a notch. But here you can see that there is an opening, a hole, the infraorbital foramen. Don't mix it up with the inferior orbital fissure. The infraorbital foramen is for the passage of the second division of trigeminal nerve, that is the maxillary nerve. Which branch of maxillary nerve? The infraorbital branch of maxillary nerve. We'll discuss these nerves in detail when the time will come. You don't have to worry about that. All you have to remember that in the floor of the orbit, because I told you that the maxillary division of trigeminal was running in the pterygopalatine fossa, and the inferior orbital fissure was communicating with the pterygopalatine fossa. So a branch has been given off by the maxillary nerve before it enters the pterygopalatine fossa, and that branch runs in the floor of the orbit, and because it's running in the floor of the orbit, it's also known as the infraorbital nerve. The infraorbital branch of maxillary nerve is going to come out through this infraorbital foramen and will supply the skin over the cheek, because it's a pure sensory branch. Okay, so I hope that you have understood the connections of the orbit along with its openings. Okay, let's talk about the nerves which are entering through these openings, the nerves which are entering the orbital cavity. The first and foremost was our second cranial nerve, the optic nerve, which passes through the optic canal and enter the orbit and reaches the posterior surface of the eyeball. Okay, so in functional terms, if I speak of the optic nerve, actually the optic nerve starts from the back of the eyeball. It's like starts from the retina and then forms its cord-like structure and then enters the forebrain. Okay, so I'm not going to talk about the details of the formation of optic nerve because we are going to discuss it in our segment of cranial nerves. Okay, the first nerve is the second cranial nerve. Then we come to third, fourth, fifth, and sixth cranial nerves. So you just have to, I want you to remember that the first cranial nerve was the olfactory nerve, was going to the nose. But the second cranial nerve, the third cranial nerve, the fourth cranial nerve, 80% of the fifth cranial nerve, and the sixth cranial nerve are entering the orbit and serving the contents of the orbit. Okay, so the second we just have covered, the optic nerve. Then you remember that this large slit-like opening is the superior orbital fissure. Now look at this. I have entered the probe through the optic canal, and this is the second cranial nerve. Then comes the third cranial nerve, the oculomotor nerve, which will enter through the superior orbital fissure, the medial end of the superior orbital fissure. The oculomotor nerve is going to, the name is indicating, it is motor. So it is going to supply the muscles of the eyeball, the extraocular muscles of the eyeball. I'm not going into the details, just I'm trying to make it more understandable that the oculomotor nerve, or the third cranial nerve, is the motor supply to the extraocular muscles. So it has to enter the eye orbit, and it has to remain in the orbit. Okay, then comes the fourth cranial nerve, which is trochlear nerve. The trochlear nerve, again, is a nerve which is going to supply a muscle of extraocular group, right? The superior-oblique. We'll talk about it. Then comes a nerve which is known as trigeminal nerve. It's the fifth cranial nerve that is also present in the middle cranial fossa. The first division of the fifth cranial nerve is the ophthalmic division. It's purely sensory division, no motor component. Then the second division of the trigeminal nerve is, we just have talked about it, the maxillary division. That is also purely sensory. So the first division of ophthalmic, the first division of trigeminal, the ophthalmic division, V1, will enter and will give off its branches to supply the mucosa of the orbit and the eyeball. Then comes the so you know that the second division of trigeminal was passing through the rotundum and was again entering in the floor of the orbit, was supplying, it's giving off a branch that is known as infraorbital. So the two of the trigeminal divisions, the first and second, ophthalmic and maxillary, will be entering the orbit somehow or the other. Then comes the sixth cranial nerve, that is the abducens nerve, which is responsible for the abduction of the eyeball. So the lateral rectus muscle will be supplied by the abducent nerve. So the second cranial, optic, the third cranial, oculomotor, the fourth cranial, trochlear, the fifth cranial, that is ophthalmic and maxillary divisions of fifth cranial nerve, the trigeminal, will enter the orbit, and then the sixth cranial nerve again enter the orbit through the superior orbital fissure. So we will talk about the superior orbital fissure when I will sketch the drawing, and you have to understand how things are arranged in the superior orbital fissure region, because it allows the passage of many vessels and many nerves, and along with that it also allows the passage of the superior and inferior ophthalmic veins. Okay, the veins are going to leave the orbital cavity and will dump their deoxygenated blood into the dural venous sinus within the cranial cavity. So these are the connections along with the structures which are passing through these openings into the orbital cavity. Next, we will talk about the the lacrimal apparatus, which is also located in the bony orbit.